station.
Okay.
Okay, so if you have read and understood, considering a history taking station, please begin.
Hello.
Yes, doctor. Please do something for me.
Yes, I'm Dr. Mahir. First, I'm Dr. Mahir, one of the surgical doctor here. Can I confirm your name, please, and age?
Doctor, I can't talk very well. I have this shortness of breath.
Yeah, I'm very sorry to hear that.
Yeah.
Could I give you some oxygen?
Yes, I'm Mrs. Sarah, and I'm 50 years old.
I'm very sorry to hear about your shortness of breath, Mrs. Sarah. Do you want me to give you some oxygen?
Yes, please.
Okay, we give her oxygen.
Okay.
Okay. I will try to move fast, Mrs. Sarah. Today I have been asked to ask you some question regarding your health, and I will write down while asking you. Is that okay with you?
Yes, doctor. Yes, please do
If you
anything.
feel that you cannot speak like that, you tell me, and I can stop. But we should go through this because we need to help you to figure out what is the problem. Okay?
Okay.
Okay. Could you please tell me more about your shortness of breath? When did you start it?
Yes, this started like 4 weeks ago.
Okay. And is it all the time there or come and go?
Yes, it's become worse and become all the time with me. That's why I'm here.
Okay. And is it like increased by any activities, or is it at rest even?
No, at rest, doctor. It's become at
Okay.
rest. Yes.
And do you have more shortness of breath while lying down?
No,
Is it increased
doctor.
by lie down?
No.
And do you have any getting awake from sleep before gasping for air? Any episode like this?
No, doctor. No.
Okay. And could you please tell me, do you have any chest pain?
Chest pain.
Yeah.
No.
Do you feel any pain in your chest?
No.
Okay. And could you please tell me, do you have any cough?
No, doctor.
And do you brought anything up with your sputum, like any blood in your sputum, something like that?
No, doctor. I have chronic pulmonary obstructive disease and diagnosed about 2 years ago, and I have the regular time for cough, but now I don't have cough, doctor.
Okay. And could you please tell me what you are taking for this your COPD disease?
Yes, I give some medication, but I don't remember what is it.
Okay. That's totally fine, Mrs. Sarah. Could you please tell me, do you have any weight loss?
Yes, about 1 kilo.
And could you please tell me about your weight before and now?
Yes, I feel my weight is going down, and about I scale in the last week have lost 1 kilo.
And how much was your weight before?
Yes, around 85.
Okay. And could you please tell me, do you have any loss of appetite?
No.
And do you have any night fever or night sweat?
No, doctor.
And do you have any previous medical illness other than your COPD?
Yes, I have this COPD and I have also hypertension and coronary artery disease, doctor.
Okay, I'm very sorry to hear that. Could you please tell me what you are taking for this?
Yes, for hypertension, I am taking amlodipine, 10 milligram, and also I have for coronary artery a lot of medication, doctor.
Okay. Do you take aspirin?
No, I will take the warfarin.
Okay. And can you please tell me why did they give you warfarin, and when was that time you started warfarin?
Yes, this is about 5 months ago, and this is for that coronary artery disease that happened to me.
Okay. And do you feel same episode like your coronary when your coronary artery disease came like 5 months ago? Do you feel the same episode now?
No, that is came with chest pain.
Okay. And could you please tell me, do you feel aware of your heartbeat?
No,
Okay. And do you have any allergy from any medication?
no,
And do you have any family history of similar condition, shortness of breath,
Okay,
like
can
any?
you summarize your history now, please?
Okay. Today I took history from Mrs. Sarah, 50-year-old. She's known case of COPD. She's taking medication for that, and she can't remember this. And she has hypertension. She's taking amylo, and she has history of coronary artery disease. That was 5 months ago, and she's taking warfarin. She's now complaining of shortness of breath. That is for 4 weeks. Started gradually, and it's progressing to be continuous all the time. No orthopnea, and she have a weight loss of about 1 kg. Her weight is 85.
Okay,
my
so what are,
provisional
yes,
yeah,
provisional and differential
my
diagnosis.
provisional diagnosis is for such shortness breath, I consider this to be heart failure, considering it for 4 weeks. And also I consider pulmonary embolism and myocardial infarction. And also I will consider it to be chest malignancy or chest tumor.
What investigations would you ask for to rule out your provisional diagnosis?
Yes, if time would allow me, I will complete my examination by asking about the
History.
social history
Yes.
and yes, asking about any symptoms of calf pain or calf swelling or history of tropial, any history of hospitalization or surgical operation
Yes.
that limit her movement.
Yes.
Then I
Family
will go to
history.
do a full cardiovascular examination
Yes.
and cardiopulmonary examination. Then I will request general investigation like full blood count, urea and electrolyte, liver function test, and coagulation profile. I would also do CT pulmonary angiography and echocardiography, and also I will do I would do for excluding myocardial infarction. I would do ECG, and I would do cardiac enzymes like cardiac troponin.
Yes.
I will also do duplex ultrasound of the lower limb to exclude any cause of the pulmonary embolism as risk factor, the DVT.
Okay. Right. What was your provisional diagnosis again, please?
Yeah, I would consider heart failure in such case
Okay,
because
why?
for 4 weeks, the history is for 4 weeks, and she has history of myocardial infarction. So there is cardiac risk.
Yes, rest, complaining of substernal chest discomfort. All right, you'll rule that out. But patient was already on warfarin as patient had unprovoked pulmonary embolism episodes previously. And since patient is already known COPD and taking steroids.
Yeah, I would consider also pulmonary embolism.
Okay. Right. How would you manage this patient then?
Okay. Considering heart failure, I will yes, I will include the cardiologist, and I will do further investigation to check for the heart function, and I will go to do either to give diuretics, and also I would give beta blockers. If confirmed pulmonary embolism, then I will go to first risk factor modification, like exercise, and yes, and I will do give antiplatelet, and I will give also yes, I will give heparin and or Clexane if it is non-massive. If it
Clexane
is
is
massive,
heparin.
then I will go to do
Yes.
either embolectomy or thrombolysis.
Thrombolysis. Okay, good. Right. Since the patient came in accident and emergency, and patient is complaining of dyspnea and chest pain, you'll manage the patient according to the ABC protocol. First of all.
Yeah. According to the care of
And
critical
then,
ill patient.
yes. Good. Thank you.
Okay. Ma'am,